Dr. Jenab, we can't hear you.
Yep. All right.
Okay. Can you?
Yes, I think we are back on. Sorry about that, everyone. Technical difficulties at the beginning of the year, but I think we are ready to start. So again, I'm here. I'm going to hand it back over and we will start. All right. So I'm going to stop my video here and mute my mic and you are ready to go.
All right. So hi, everyone. Again, sorry for that technical hiccup. My name is Dr. Arvin Jenab. I'm a naturopathic doctor at the Samueli.institute. I've been with the Samueli.institute for just over 10 years now. I am the director of the naturopathic medicine program and oversee our residents here. I have a practice here. I see patients, and a lot of my focus is on chronic conditions, including chronic GI conditions or gut issues. And I'm really happy to be here. In the years that I've worked with Chef Jess, this is the first time we share the stage together. So feel privileged and thank her for the opportunity. I'm going to talk about integrative gut health, and sort of my note under that is everything but the microbiome. And I say that because so much focus is on the microbiome right now, especially with respect to what we're learning in research. And I know you've heard a lot about the microbiome and the microbiology of our gut and how important it is. And it's certainly extremely important, so I don't want to take away from that. But I thought this talk can speak to some of the more practical concepts or perspectives that inform how we practice and how we support overall GI health, which then sort of has a downstream impact on our microbiome. So really, we're talking about upstream influences that impact downstream function. And as much as the microbiome is important, I think sometimes we lose track of how important it is that our entire digestive health is improved so that the microbiome has a chance to survive and thrive and give us the health that we're looking for. Excuse me. So I'll start with just some broad strokes. So we know common symptoms and conditions related to the digestive system. We're all familiar with abdominal pain, gas, bloating, distension and constipation, diarrhea or nausea. There's also some disorders or conditions that we're familiar with, things like IBS, IBD, which includes Crohn's or ulcerative colitis, some infectious diseases, celiac and gastroparesis. And then less commonly or less discussed are some of the systemic symptoms that we see associated directly to GI health. These can include things like allergies, arthralgias or joint pain, skin issues, myalgia, which is our muscles aching or being inflamed, fatigue, headaches, mood and cognitive disorders, and autoimmune diseases. And this is not a comprehensive list. We can almost always relate conditions back to some GI imbalance or dysfunction. And that's why we think that improving and healing the gut is an important foundation for long-term sustained health. The other thing I want to bring attention to in this slide is just the fact that another important factor, other than just the symptoms and the conditions, is the behavior and the patterns that we observe with these symptoms. And that's really important as an integrative provider, where we're looking at, the timing of symptoms, whether they appear after eating or before we eat, on standing or lying down, when stressed or anxious, or with certain foods at certain times of the day. And those details really help inform and help us investigate what's underlying some of the GI issues that may be driving your symptoms. Some foundational concepts that I think are really important to keep in mind. One is to consider the landscape. If you think about the digestive system, it's a continuous tube. It's got specialized areas and accessory organs to support them. And on the right, you'll see a diagram that essentially shows you from the mouth all the way down to the rectum. We've got different areas, all continuous, all connected. However, each having a very distinct role and each having distinct regulatory mechanisms. So they're under tight regulation and they function to support each other. Usually it relies, or the digestive system relies on signals that help to regulate. The signals could be neurological, or it could be endocrine, or it could be physical symptoms like food entering our digestive tract. And we also know that failure or dysfunction in one area almost always affects the performance of other areas in our digestive system. So part of our job as integrated providers is to try and identify which area is essentially at the root or at the cause of the dysfunction that we're observing in patients, and start to focus treatment on optimizing those areas so that we can expect outcomes to follow suit. We also think of the digestive system as upper, middle, and lower GI, and that helps us to sort of think in terms of categories of function so that we can, again, investigate and identify what the core issue is. There's what we call the migrating motor complex. I think it's really important to be aware of. Migrating motor complex essentially is the migrating or the propulsive contractions from the stomach all the way down to the ileum and the colon. And this essentially is the movement, if you will, or the rhythmic muscular contractions that are moving food all the way from the esophagus down to our small intestines and the ileum before they enter the large intestine. And another one is to just, again, keep in mind that secretion, digestion, and absorption are all important functions. But another function that sometimes gets overlooked is the function of elimination and detoxification, and the microbiome plays an important role in that. And this often, when there's an overburden of toxins or a failure to detoxify or eliminate, that's sometimes when we see some of the systemic symptoms like joint pain, skin conditions, and so on. Also important to note the enteric nervous system. This is the nervous system that essentially lines the gastrointestinal tract, and it's 100 million nerve cells that are lining the tract, and they're very sensitive to different stressors and different stimuli. And it's essentially the nervous system that's communicating directly and indirectly to our neuroendocrine axis. So very important feedback mechanism so that our nerves and our hormones can help to regulate digestive function based on that feedback. And then lastly, the microbiome, which is essentially the constellation of bacteria that make up our microbiome and have a very specific function in digestion as well as metabolism, which I think you've heard about that one from Dr. Whiteson some time ago. All right, and we couldn't talk about the digestive system without talking about brain-gut axis. This is something that used to be novel a few years back, but now it's well accepted and well established that the gut-brain axis is real. There's a two-way communication between our central nervous system and the enteric nervous system, and this links our emotions and our cognitive centers of the brain with our gut health. And this is extremely important, especially because what we're seeing is that there's a surge of functional GI disorders or functional gastrointestinal disorders, which have no physical or organic cause, meaning there's no disease or structural issue that's causing them, but they've been linked directly to functional disorders that are mediated by what we call the gut-brain axis. And these disorders are classified by symptoms, and they could be any combination of the following, following not symptoms, but following concepts, if you will. Motility disturbance. So if there's a decrease or increase in motility, you can see constipation or diarrhea. If there's increased hypersensitivity in the intestinal mucosa, that's where we see some reactions to foods. and also sort of systemic reactions where our immune system is reacting, and that could drive some of the immune modulating effects that we see with poor digestion. Altered mucosal immune function. This is, again, the mucous membranes and immune function that's inherent to our digestion. If you remember, the intestinal lining is sort of in our barrier between the outside world and the inside world. So there's a strong immune presence that's protecting us. And if that's altered, that's going to increase our risk of developing conditions, whether it's symptoms that are within the GI or whether it's systemic symptoms. Altered gut microbiota, this we see, and if you've heard the term SIBO, small intestinal overgrowth, then you know that microbiome is extremely important, both in how we feel and the symptoms we experience, but also in how we metabolize foods and also in intrinsic hormones and metabolites. And the last one is altered central nervous system processing, and this is where we might again see some increased motility or increased symptoms associated with emotional triggers and cognitive triggers. This is the upper GI. I'm not going to go into too much detail. I imagine you already know what low stomach acid might feel like. If we don't have enough stomach acid, we tend to not break down foods. If we can't break down foods, we tend to start having some digestive symptoms. So it could be anything from nausea, indigestion, bloating, reflux, heartburn, gas, diarrhea, and then nutrient deficiencies, which rely heavily on our stomach acid to break down and release some of those nutrients, iron being an important one, B12 being another one. But essentially most minerals that we absorb require an acidic environment or the stomach acid to act on them, to release them. So in many cases, low stomach acid may result in multiple nutrient deficiencies, which we then see downstream as symptoms associated with either hair, nails, skin, our musculoskeletal system, and so on. And then gastroesophageal reflux disease, again, really important. And the importance of this has more to do with, again, depending on whether it's a functional disorder or if it's a real disorder. And to give you an example, a real structural condition might be a hiatal hernia causing reflux disease, whereas a functional disorder might be sensitivity of the mucous membranes overreacting or hyperreacting to foods that are introduced into our diet, and both result in heartburn or gastroesophageal reflux. But as you can imagine, the treatment and the approach would be very different in those cases. Just to sort of include some research to support what we're saying, I wanted to highlight the H. pylori infection, which you may be familiar with, and the strong association with hypochlorhydria and downstream GI symptoms. So this is something that we will test for and then account for in our treatments. And the second research is really drawing attention to the fact that SIBO occurs significantly more frequently. So this is essentially a dysbiosis picture, associated more frequently among patients who take PPIs, and PPIs or protein pump inhibitors, as you might know, they decrease stomach acid. So we see the effects of low stomach acid on again, downstream intestinal health. Let's move to the middle or the middle GI, if you will. This is where our accessory organs are. Most notably are the pancreas, the liver, and the gallbladder. And both pancreatic and gallbladder insufficiency are extremely important for us to evaluate. What we're learning is that gallbladder insufficiency or just dysfunction, or what's now known as dyskinesia, and pancreatic insufficiency or dysfunction both can lead to disorders of the GI, including a lot of the common symptoms associated with functional GI disorders. This could include poor digestion, poor absorption, poor elimination, as well as immune activation, motility issues, SIBO, as well as systemic issues. And just to give you an example here, I sort of included the example of gallbladder stones. And with gallstones, for example, there's decreased functional bile that's being released, and that usually impacts how we absorb or metabolize fats, which then results in fats entering the intestinal system, causing inflammation, causing damage to the intestinal mucosa, and that leading to systemic changes or systemic inflammation and immune activation, which then can cause systemic symptoms. So again, it's an upstream organ that if not functioning well, can have a lot of downstream symptoms. And the pancreas, similarly, if the pancreas is not producing sufficient enzymes to break down our foods, we'll have food particles entering intestines, that should have been broken down. And at that point, the bacteria can start to act on those food particles, releasing toxins and causing inflammation and ultimately intestinal barrier dysfunction and systemic inflammation and symptoms. All right, and we're seeing bile acids more and more involved in how our gut microbiota are regulated. So we have bile, which released from the gallbladder, which has what we call bacteriostatic properties. Essentially, it acts as a natural or a built-in antimicrobial, if you will, but it selects against the bad bacteria and allows healthy or good bacteria to thrive. And so in that way, it's selective and allows for a healthy intestinal microbiome. But when bile acids are not interacting properly or have, if there's dysfunction, what we see is that there's a shift in the gut microbiota. And obviously, from there, we could see functional disorders or changes and ultimately symptoms. Same with pancreatic enzyme deficiency. This can be a common cause. We actually think up to 20% to 30% of patients with functional disorders of the GI can have some type of pancreatic involvement. So the diagnosis is not difficult. It's just a matter of recognizing that it could be a potential because the symptoms are very similar to other GI conditions. So bloating, cramps, or discomfort after eating, diarrhea, loose, greasy stools, gas, flatulence, and weight loss can be some symptoms. But as you can see, those are very broad and general symptoms. So it's often misdiagnosed or overlooked. You've probably heard of leaky gut. This is sort of, we're moving down now. So we started with the stomach and the gallbladder, pancreas, and now we're moving to intestinal lining. The intestinal lining is really important because it's the last step in our digestive enzyme activation, if you will. There's enzymes within what we call the brush borders that are breaking down some of the carbohydrates, especially the disaccharides. And those disaccharides, if they're not broken down properly, that can lead to putrefaction and increased sort of fluid buildup. And I think I'll touch on it in the next slide. And that's we're seeing a strong correlation with disaccharide enzyme deficiency or dysfunction and patients who are experiencing chronic bloating, indigestion, especially those that don't seem to be benefiting from some of the dietary and supplements. So dietary interventions and supplements that they may be taking. So if you take digestive enzymes, herbal bitters, and maybe you've tried something like the low FODMAP diet and you're still having symptoms, what we're seeing is that a lot of those patients may actually have disaccharide enzyme deficiency, and that's why they're not very responsive to some of the diets and the supplements that we introduce. So in this case, we're looking at leaky gut, or what's better known as the gut intestinal hyperpermeability. This is when the space between the cells that line our intestinal lining are compromised, and now there's increased antigens or the food particles, bacteria, or toxins that can now leak, if you will, through the intestinal lining and then trigger our immune system, which lies beneath that. Some of it can get into our systemic circulation, into the blood, and go around in our circulation and cause systemic inflammation or symptoms, including things like allergies, hypersensitivity, joint pain, sometimes things like brain fog, muscle aches, a lot of what sometimes patients associate with having chronic fatigue or fibromyalgia type symptoms. So it's that feeling of stiffness, pain, brain fog, fatigue, and sometimes, lymph nodes can get swollen if it's more of an advanced case, and hormonal changes. And we're seeing a lot more studies. We've seen a lot of studies come out in terms of nutrients and dietary interventions that can help leaky gut. And these are just some examples and some review articles for those who are savvy and want to go and look at the research, and references are at the end of this talk. But there's significant improvement in patients who engage in these treatments. So there is a strategy that we employ, and I'm just going to skip. No, I'm going to go back to it. But the strategy is essentially to remove the antigens or the culprits, and then use these nutrients to try and repair the gut lining, and then reintroduce. And I'll speak to that a little bit later. Laboratory testing has evolved quite a bit. So there's the traditional blood tests and stool testing, which we still do. So anything from blood tests to some of the markers that help us understand how the gallbladder, liver, pancreas might be functioning. There are stool tests that tell us if there's fecal fat or if there's increase or decrease in certain enzymes that are important for digestion. And then we see now a surge of labs and testing that are looking at things like food sensitivity or comprehensive stool tests that look at the microbiome breakdown and help us understand if there's overpopulation or underpopulation of certain bacteria that may be contributing to symptoms. We're also looking, we look at things like pancreatic enzyme, inflammatory markers, microbiology testing, which is similar to, which is embedded in some of the comprehensive stool analysis, as well as direct intestinal permeability testing. So actually testing to see if there is intestinal permeability that may be contributing to a patient's health concerns. The cases where we might do this is patients who have autoimmune condition or chronic inflammation, and treatment doesn't seem to be helping them, so they're treatment resistant. So we're looking for the source. Is there some source that's introducing toxins or inflammatory promoters into the body that's preventing the patient from getting the full benefit of the treatments that we're introducing? And ultimately, the goal is to treat upstream, optimize function as we go down from the mouth all the way down to the rectum. And then with that, expect healthy and more sustained outcomes so that people have sort of long-term improvement rather than just symptomatic relief. So what diet is for me? This is a question we get asked all the time, and there's a lot of information and misinformation when it comes to diets. I'm not going to go in this talk into sort of details about each diet, but I did want to bring attention to at least one diet, and that's the low FODMAP diet. I think it's one that's becoming more relevant when we look at functional GI disorders. Functional GI disorders, is, if you go back to what I spoke to, is the gut-brain axis and is sort of the source of a lot of symptoms that we're seeing in patients, and in a growing number. I think they're saying somewhere near 30 to 40% of patients with GI symptoms are actually experiencing functional GI disorders. And so a lot of the doctors may not know what to do because they're not finding anything when they do tests. However, functionally, we know we can support them. And one way to be really helpful is the low FODMAP diet. And this is essentially a diet that's low in fermentable, oligosaccharide, disaccharides, monosaccharides, and polyols. These are carbohydrates. And it goes back to what I was sharing with you about the brush border cells and how there's disaccharide deficiency in some patients. If we decrease the FODMAP diet or decrease FODMAPs and the patient improves, that's great. If we decrease, patient doesn't improve, then we go further to further limit some of those disaccharides and hopefully see improvements there. This is a little more technical, looking at sucrase isomaltase deficiency. These are essentially, this is the hypothesis, if you will, patients who don't respond well to the low FODMAP diet or don't respond at all to the low FODMAP diet. It's possible that they have sucrase isomaltase deficiency. And this is where there are tests now through your gastroenterologist where we can look for this deficiency. And again, this deficiency really underdiagnosed. A fair number of patients who have GI symptoms that are persistent are showing up as having sucrase isomaltase deficiency. Now, the condition is well known as a congenital condition in children, but we're seeing more and more adults with sucrase isomaltase deficiency. And right now, we don't know what the cause may be, but I guess in the future, we'll know more and hopefully share that with you. All right, so again, low FODMAP diet has been great in patients with IBS and motility disorders, unless they have the disaccharide deficiency. Another condition that's emerging, and we're seeing an increase in both recognition of patients who may be experiencing this condition and increase in diagnosis, is mast cell activation syndrome. And mast cell activation is not limited to the digestive system. It impacts all of our immune system, if you will, and can contribute to systemic symptoms. And on the bottom right, you see things like respiratory, neurological, mental, emotional, musculoskeletal, digestive, skin, cardiovascular, and genitourinary. All these systems can be impacted, but there are a lot of GI symptoms that are, again, consistent with what we see in patients. So we see things such as bloating, indigestion, nausea, heartburn, constipation, and diarrhea. Again, a lot of these symptoms are non-specific, so this becomes really difficult to diagnose unless you start to, one, understand it and learn to recognize it. And we're learning, or we're developing tests that help us screen for these mast cell activation syndrome patients. All right, and there's some really, articles have been coming out and including some CME events for gastroenterologists to start to be more aware of how to identify this. But in an integrative setting, we seem to be primed to recognize this because we're doing a whole person approach to health. And not only do we look at the digestive symptoms, but we tend to evaluate all systems. And because we evaluate all systems, we start to see these patterns where patients may have some dysautonomia, hypersensitivities, systemic inflammation, and digestive symptoms. And we start to think more broadly that maybe this is a mast cell activation syndrome affecting the whole body rather than a digestive symptom limited to the GI tract. Okay, this is the 4R gut healing. This is the remove, replace, repopulate, repair. It's just a sort of a strategy that most of us integrative doctors will employ. And pretty simple. We remove the culprit, clean up the diet, we replace enzymes to improve conditions for health and better digestion. We repopulate with healthy bacteria, and then we make sure we repair anything that's requiring repair. That includes the mucous membranes, as well as the immune system that needs to be robust to continue protecting us. And then a lot of supplements, and again, I'm not going into supplements in terms of dosing, but I think it's really important to understand what informs us in terms of how we approach patients. The supplements we use depend really on the underlying mechanism. So once we have an understanding of upstream contributing factors to GI disease or conditions, then we really use that to then inform which supplements to at least initiate with a clear strategy. So it might be that we need to spend 3 months just building up the stomach acid, decreasing stomach inflammation, improving gallbladder, pancreatic function before we even get down to the intestines to improve intestinal lining and microbiome. So strategy becomes really important when we're working on long-term or chronic digestive disorders. And so the groups, if there's poor breakdown, we rely on certain nutrients and herbs. If there's inflammation, we rely on anti-inflammatories, binding agents, antioxidants, and emulsants. There's compromised barrier like the leaky gut. There's specific nutrients that have proven extremely helpful in helping rebuild that gut lining. And then if there's immune dysfunction and hypersensitivity, we rely on specific nutrients that help to modulate the immune system and then decrease or subdue some of that hypersensitivity to prevent further damage while we try and heal. And then a long list of other supplements that some of them are listed on the right side for you. And then these are more specialized. Some help with specific, dysbiosis picture. Others might be more immune related, like colostrum, and binding agents we often use if there's exposure, so toxic exposure or poor biliary function. Here's more list for you. So again, I won't go into a lot of detail. I'm happy. I don't know if we take questions here, Chef Jess, but I'm happy to take questions. But yeah, we use a lot of herbs. Herbs are extremely effective. So herbal bitters or Swedish bitters, I'm sure you've heard of. Enzymes, bile acids. So depending again what we're treating, we'll sort of use a limited number because we can't put patients on all of these supplements all at once. But we employ a really clear strategy, and so we sort of guide patients through that strategy. And sometimes it takes a year to really get to the end point that we're trying to get to with patients. And then food plays an important part, and I know that's why we're here, and Chef Jess is here to teach us how to eat healthy and sort of diversify our diet. All right, collagen is another emerging area. This is SIBO, which I can answer questions on it, but I won't get into right now. And I put this up because these are some of the specific nutrient or specific ingredients that Chef Jess is using today in her recipes. So I thought if you have access to these slides, you can refer back to this to see some of the health benefits of the specific nutrients. But the goal is always to do whole foods that provide a balanced source of nutrients. And then depending on your GI needs and your symptoms, it might need to be modified, and you can work with nutritionists or your providers to figure out how to individualize this for your specific needs. All right, so in summary, healthy digestion is the product of complex and coordinated functions involving many organs and systems, really important. The dysfunction in one area affects other areas of the digestive system. Feed upstream while optimizing downstream, it's really important. So trying to fix the intestines without first fixing stomach acid, gallbladder function, or pancreas tends to be counterintuitive, but also have it's limited the benefit, and we often end up seeing the patients and having to treat them again a few months down the road. Problems in the digestive system may be the result of systemic causes and may also cause systemic health issues. Not all diets are for everyone, so be mindful of how you eat, be mindful of how you respond to the dietary changes you make. And if you're getting inconsistent results, talk to someone because there may be actual enzymatic or organ dysfunction that needs to be addressed. And for that, there's therapeutic diets that are more effective. Treatment must be strategic and appropriate, and that food will always be your best medicine. And negative emotional responses and stress, your greatest obstacle to achieving health. So both of those need to be addressed. And then lastly, integrative approaches to digestive systems can be extremely effective. And the benefits reach far beyond the digestive system. There's a whole person impact that benefits all aspects of one's health. So if you haven't worked with an integrative doctor, what you'll find is the GI might be the entry point or the gateway into a whole world of better health that impacts all of you and all of the organs and systems, not just your GI. So thank you, and I'll stop there. And
You have one question.
Say.
You do. You have one question about more. If you go click more.
Oh,
there
yes,
it
I
is.
see it. All right. Yes, a great question. So the question is, what if your gallbladder has been removed? We actually see this quite often. They really like to remove gallbladders in the 80s and 90s. And so we have a lot of patients now without gallbladder, and it still happens. It's one of the more common surgeries. So gallbladder, if it is removed, that essentially has strong implications. So the gallbladder essentially is where our bile is stored and concentrated. So without a gallbladder, we have bile that's being produced by the liver and then excreted into the intestines without having a place to get stored. And so what that means is that there's this constant, if you will, or constant trickling of bile into the intestines without any regulatory mechanisms acting on it. So normally the bile would get stored, it'd get concentrated, and it'd wait for a signal before it's released. In patients without a gallbladder, there is no signal, there's no storage form of bile, and the bile that is produced is not concentrated bile, because that's the function of the gallbladder. And so there are specific adjustments that we would recommend patients make with their diet. So usually it's more frequent, smaller meals. You want to make sure there's sufficient binding agents like fiber, so that bile is not sort of circulating or floating around freely in the intestines. Bile is an irritant and can really cause a lot of irritation and motility issues. So the goal is always to decrease the irritability that's associated with bile being in the intestines without being bound to something. So, and if psyllium is a good source of fiber, yes, absolutely. Psyllium is a soluble source of fiber. So again, remember, psyllium as a soluble source is great as a binding agent. It's not always great for patients who might have IBS constipation because it's very bulking and it could cause discomfort. Other good fibers include things like chia seeds, which you'll hear about in one of the recipes today. And there's ground flax seeds is a good source of soluble and insoluble fiber. And there are a few fibers in the market if you wanted to go the supplement route. There's things like apple pectin, prune fiber, and so on that are available. And again, any other questions I'm happy to take. Otherwise, well, I'm sure looking forward to Chef Jess teaching us a little bit about some of the foods that she's here to teach us cook. I'm especially interested in the chia seed ice cream.
Yes. And so the chia seed ice cream is because of him, just to let everyone know. He approached me a while back about people who just like sweets and how do we curb that sweet tooth? And I always say you can curb that sweet tooth by adding a lot of fiber. Mm-hmm. And so then he said, well, is there any way we can make like a chia seed ice cream? Mm-hmm. And so we did. So we've made a chia seed ice cream. And one of the questions that I think you're going to ask us is, does blending the chia seed break down the fiber? And it does. But it's still a great source of fiber at the end of the day.
It is, yeah. And chia seeds also have protein. I think that's really important to note. Yeah. So something like psyllium husk doesn't have protein, but chia seeds actually are a good source of protein as well. So you get both protein and fiber, which is unique to chia seeds.
So then we might as well start with the chia seed ice cream. So I'm going to share my screen. All right. And I'm going to start over here
Thank you.
because this is so chia seed ice cream. What are we going to use to sweeten it? We're going to use dates. So we are going to use dates that are pitted, and you don't need to soak these as long as you're using a high-speed blender. So if you don't have a high-speed blender, maybe soak the dates a little bit. And then we're using almond milk, but you can use any kind of milk that you have at home. If you make your own oat milk, which I suggest instead of buying, if you do the oat milk, even just regular milk is perfectly fine for this. Now, we get to add my favorite ingredient, which you all know is cacao, not cocoa powder. And now why? The difference between cacao and cocoa is that cocoa has been heat treated. Cacao hasn't. So remember, there's a lot of healthy benefits inside chocolate. And if we heat treat it, what ends up happening is you remove a lot of it. So cacao is best ingested raw. The problem is most chocolate recipes have you cooking the chocolate, and so you lose a lot of the benefits. This is one of those few times where you can use it raw and you're not changing it. There's no heat being added to it, and so you get the full benefit of the cacao powder then. And then we got chia seeds. And my trick with chia seeds these days, if you haven't heard me say it, stop buying it from the bulk bin. You know, like at Sprouts, they have like the bulk one, or at Whole Foods, you can buy it in bulk. What's happened, I've realized, is it has a lot more of the seeds inside. So it has like remnants of something other than chia, and can get a little grainy then. So I like buying the chia seeds that are in packages already to make it easier. And then a sweetener. So you do still need a little bit of a sweetener of whatever kind. You can use maple or honey or date syrup. So we like date syrup in here too. Out of all of those, though, honey is going to be the sweetest. And so just always remember, honey tends to just be a little bit sweeter. And then you can melt a little bit of extra chocolate to add in there as well. Or you can stir it in. But then I'm going to turn it on. All right. And then you get this sludge. Now, there's a whole world of different ice cream makers. Say you don't have an ice cream maker, which is completely fine. You don't need an ice cream maker with this. What happens is there's chia seeds in here, and the chia seeds start soaking, right? All that liquid. And this you could actually eat just like this. Do we have that extra with that big ugly one? And it looks like pudding almost. Oh, I put it right here. I did. And so it looks like pudding. So this one's been sitting for a little bit. And if you look at it and I poured it out, you could actually see how thick it is, right? It almost glops. So if you think about this as the consistency of mousse, you could eat it like this. Or you can put it in your ice cream maker, depending on what kind of ice cream maker you have, and it will make ice cream for you. Now, if you don't have an ice cream maker, this is all you do. You take this out and you just use a handheld mixer every 30 minutes. So every 30 minutes, I put this in the freezer, take it out after 30 minutes. Use a handheld mixer, or if you don't even have that, you just take a whisk and you whisk it. The idea is that you're whisking in air. But what I want you to notice is that this consistency is already pretty smooth and like rich tasting, that you will get that same effect even if I just took this whole thing and put it in the freezer. So if you have a sweet tooth and you love ice cream, this has got to be one of the easiest ways to get ice cream in your diet, or get ice cream in your diet like we had. Now.
Can't wait to taste it.
Yep. Mm-hmm. Another dessert, because we can't get away with desserts. Too many great things to eat. And so for this dessert, super simple. Ooh, where did I put all the stuff? over here. I'm going to take one egg. And I know everyone, sorry, eggs are very expensive right now. So I know everybody's like, no, I can't make this right now.
Chickens are cheap.
Chickens are cheap. I haven't figured that out. Yeah, it's like, why? Yeah, it gets me. It's like, why have the chicken prices not raised as much as the egg prices? It's very interesting.
No, I meant get chickens
Yeah.
to lay the eggs.
Yeah. Okay. But I found out chickens only lay one egg a day. So if I have a family of 5, I need at least 5 chickens. And if I have a husband that needs 2 or 3 eggs a day, you got to keep doing the multiplication.
You need a farm.
Yeah, we need a farm at that point. And so a little bit of honey again. But yeah, those chickens, you gotta. I would tell you where to go buy eggs right now, but I failed because they're still out. So what I noticed was that Sprouts was carrying. You guys all know that I like shopping at Sprouts just because it's local for me. But they were being nice and they were still selling them for $3.99 for a dozen. And people got greedy. And even though they limited people to 2, you know, people went back in that line and just stocked up on more. So yeah.
Yeah.
Eggs. So then what is the substitute for eggs, everyone? Flaxseed. So you can use flaxseed or chia seed, 1 tablespoon with 3 tablespoons of water mixed together, acts like that binder that you want for an egg. So say you're baking. Think of all that extra fiber that you could get into your diet by switching at least 1 egg to a chia seed egg or a flaxseed egg. And so baking becomes higher in fiber just because of that. And then we're going to add in here some coconut, almonds, and pumpkin seeds. Okay.
Looks great. Delicious.
And then we're just going to take that and bake it. So I put it on a cookie sheet to bake. And you make these really pretty like rounds, just like that. And then you can have some extra chocolate to drizzle on top because chocolate does have fiber too. But I baked these and then I put them in the refrigerator and they come right off. And you can dip them if you want, or you can eat them just like this. And so if you've got chocolate, you could dip them in a little bit of chocolate. Or again, you can eat them just like this. And they're not crunchy, but they've got like a nice little bite to them. All right. Main course, just to show you some knife skills, because those are the fun ones. So for our main course, we have a tahini bowl or roasted vegetable power grain bowl. I thought this would be a good time to show everybody and remind everybody how to make grain bowls. The recipe has a lot of components, I understand. There's like 3 or 4 different components, but this is great for meal prepping. You can roast all the veggies, and then you can make a sauce, and then all the toppings that you want to go on top of it. So I've got a great big bowl that has all these beautiful vegetables inside, including sweet potatoes. I went purple heavy today. Because why not?
Yeah.
So purple potatoes, sweet potatoes, I just cut them into bite-sized pieces. You want these small because if you think about it, all of these vegetables are going to get roasted together. And in order for them to roast correctly in the right amount of time, we want to make sure certain things are smaller or bigger. So this obviously is going to take the longest amount of time, right? So we want these pretty small and we want the rest of the vegetables pretty large then. So I've got a bowl starting already. I'm going to add these inside and I'm just going to add some onion in there as well. A large red onion. I'm going to take off the ends.
Go purple heavy.
I go purple heavy. Yeah, I think and a lot of people wonder how to get more purple foods into their diets. Red onion. Red onion's a great, great way. And we're lucky where we are. Like I even have purple cauliflower. So being in California, being where we are very lucky. And so for the onion, we definitely want to make sure they're large because if you make them too small, they'll just burn. And then your bell pepper. I'm going to take out the seeds. This stuff is bitter. So if you're trying to train yourself on bitters, eat more of it. Eat more of the white stuff on food that we tend to remove. So now I've got all that mixed together, and I'm going to grab some oil and just drizzle. Now, I've been doing this for a while, and I read a lot of other people's recipes a lot of time. There seems to be a tendency for people to love using oil, especially with roasted vegetables. Somehow, some people feel like this amount of vegetables could use a quarter cup of olive oil. I'm not a fan of using that much oil if you don't need to. We want the vegetables, all these veggies, especially like the sweet potato, they have sugars inside of them. They will roast. They will taste good. You don't need to add extra oil. When you're adding the extra oil, it just speeds up the cooking process because the oil helps cook it. It heats up and then spreads and starts cooking them. So I'm going to keep this just like this on a sheet pan. I've got some Brussels sprouts in there as well. And then we're just going to roast it. So I'm going to take that and put it in 400, 425. Either of those would work. Then we're going to make a sauce for it. So a tahini sauce, and tahini is just sesame. There's some special like Chinese dishes that call for like a sesame noodle sauce. If you have tahini, you can make like Asian food and Middle Eastern food because both of them use sesame paste quite a lot in a great way. So tahini is just sesame paste. It's just sesames ground up, this great liquid. And again, fiber and all those extra nutrients inside. And then we're going to make this a chimichurri tahini. And why chimichurri? Chimichurri is a sauce that gets you a lot of these things, the greens. And these greens are great because they provide flavor, but also something green. So I have cilantro and parsley. I couldn't get any flat leaf. I have curly leaf, which is fine. And I'm just going to give it a rough chop. I'm going to put it in the food processor later, but I'm going to mix everything else first. I've got some garlic. And if you want to add more garlic than the 4 cloves, you can, because chimichurri does have a lot of garlic inside. And this is a great way to use up any greens you might have inside your
and the garlic. My garlic goes bad.
It does. You don't use that much then, huh? No, you don't. You need to use more. This is a good way. Or you can just freeze it. You can freeze your garlic too. Yeah. So shallot. And no, you do not need to go buy an extra shallot if you don't have shallots at home. You can use an onion. Just maybe you'll need a little bit more for a stronger kind of flavor. And then we have some most important ingredient for a chimichurri, red wine vinegar. You got some red wine, and you can use apple cider, but red wine is the classic. And then some oregano and chili flakes, okay? And then our good old olive oil. I'm going to add all of this in. But what I'm going to do is I'm going to break up the garlic and onion or shallot first. Now I'm going to add all my greens. And you'll hear me say it every time. Jack LaLanne says he lived as long as he did because he ate everybody's parsley from their table. So eat the parsley.
Great.
And I definitely had more parsley. Can you get me some water? And so what you can do is you're going to thin this out with a little bit of water. You could add more acid, but it just depends on how much of the flat leaf or the Italian parsley and the cilantro that you have. So we're going to add a little bit of water to this. Thank you. And then you've got this beautiful sauce. So it's going to be creamier than a normal chimichurri just because of that tahini. But the tahini gives it a kind of, it makes it very robust then. Makes it a nice kind of flavor in there. All right. We've got that ready to go. And the last component of this is the toppings. So a lot of people will like to add toppings to their bowls. Hemp seeds, 2 protein sources. You've got beans and your hemp seeds then, okay? Some raw cherry tomatoes, avocado, again, more fiber, and a cucumber. So all of these things are going to go on the top of the bowl now after your veggies are roasted. I'm also using quinoa. So quinoa is a great source to use because again, there's no meat per se in this right now. So we're relying on other sources of protein. So I'm going to cut up these scallions. And I do use the light green and the dark green. If you think it's too strong, you don't need to use both. You can just use one. Or add that in. And then our cucumber. So I take off the ends. And if you want to add more cucumber, I feel like you can never have too much cucumber.
Mm.
Let's slice it. And then I'm a fan of making quinoa in the Instant Pot. Takes about 20 minutes. You can get a whole batch ready to go. Can you guys grab the quinoa for me? Thank you. And you can have these cherry tomatoes if you want. You don't have to. For the avocado, we're going to go around. Ooh, I hope this is a good one. It looks good, but it doesn't feel good.
Mm-hmm.
It feels hard. Oh, it's a beautiful one. Beautiful avocado. Yeah. Take that out. And we are good to go. So my veggies aren't finished roasting yet. I know that for a fact, even though I have it on super high. But I'm going to make a bowl so that you can see what it looks like at the very end. So I've got, you can put it right here. Thank you. So the quinoa, 20 minutes, Instant Pot, nice and fluffy.
Smells good.
Yeah. And see, a lot of people say it takes too long. You can even do it on your microwave, in your microwave. I'm going to put a little bit of quinoa. Oops. Put a little bit of the salad mix. If you're doing this at home, you can do it in layers too. And then I'm going to add a little bit of beans on the side. Okay, and you can even add some cheese in this. I'm going to peel my avocado feels hard. So so whenever your avocado feels hard, what you can do is you can slice it and then peel it. And it just comes off then. I think we kept it in the refrigerator for too long. There, yeah. All right. And then if there's any more questions, let us know. We are here to help. And if not, you can always email us and let us know if you have questions. All right, so I'm going to finish this. Grab some of these pieces, put them right over there. Take some sauce and ladle it right over the top. And there you go. Then you've got a
Looks
bowl ready to go. So thank you, everyone. Let us know, and we'll see you soon next time.
good.
Thank you.
Great.